Hi, Mr. Baker. So this is my oral presentation video, um, basically explaining ethics. Ethics is also known as moral philosophy, and both of those are basically concerning what is right and what is wrong, like defining what is right and what is wrong, like what makes stuff right and what makes stuff wrong. So you have three divisions of ethics. That is normative ethics, meta ethics, and applied ethics. Normative ethics is basically the study of moral norms, the moral norms that control and or guide our actions on like a normal everyday basis. Then you also have the meta ethics, and that is the study of the meaning and the logical, like the logical structure of the moral belief that you are evaluating. And then you have, of course, the application of moral norms, and that's, where you apply the moral norms in real life, like ethical issues in the real world. And then, of course, you have four elements of ethics, and this is like a little bit confusing, but the four elements of ethics are preeminence of reasoning, universal perspective, the principle of impartiality, and the dominance of moral norms. Okay, so the preeminence of reasoning is used to find a common ground while using critical reasoning, if that makes sense. And critical reasoning is basically when you analyze and question the idea and the belief, whichever you're looking into the idea or the beliefs, it's where you analyze them. Um, and as far as critical reasoning goes, critical reasoning is used, across the board in every field, in every thing. I don't even think people realize how much critical reasoning they use on a daily basis. To move on to the next one, the second, universal perspective, that just basically is saying that these are rules that apply to everybody. So you can be sure when you're talking about ethics and you're talking about like going through to figure out if something is ethical, that it would be the same ethical answer here in this situation as it would anywhere in any situation. It's just a universal, basically like a universal way that everybody can connect and understand. It's like a language in a way. And then you have three. You have the principle of impartiality, which is basically just treating everybody equal unless there's a moral reason as to why. So treating everybody equally is very important, obviously, especially in today's day and age. But like there are moral reasons as to why you wouldn't treat somebody like the same, and that would be like criminals. Like obviously you're not going to treat a criminal the same as you would somebody who's not a criminal. You also have the dominance of moral norms, and the dominance of moral norms is when there is two things that conflict. So if you have like a, I have the types. If you have, it basically explains the dominance of moral norms. Basically says no matter what conflict you have, the moral norm is the one that's always gonna win. Like it's the one that always pulls through. Um, so like for instance, there's like basically when there are two conflicts, you have legal, aesthetic, and moral are the three types. Um, and the examples for that like would be like if you're speeding to get a loved one to the hospital, um, so you're breaking a legal norm by speeding. However, your moral norm is to make sure that you're getting this person to the hospital. This person that you love needs help. So that overpowers the legal norm. And basically, it's saying that in any situation, not just legal norms or aesthetic norms, just in any situation, the moral norm always wins. It always comes out favorable. And so, as far as like how all of this, especially ethics, helps in nursing, for one, there is an entire code of ethics for nurses. They have 9 provisions in them, and I just did it for another class, so that's how I know. There's 9 provisions for the code of ethics for nursing, and ethics I think nursing is one of the main fields that is centered by ethics and morals. Does that make sense? So, like, I think so. Ethics obviously uses, we were talking about critical reasoning, and critical reasoning is the consideration of reasons or in questions. So that's basically, critical reasoning is used, again, like I said, throughout all different fields. It also, understanding ethics also helps us to decide the possibility of injustice, suffering, and wrongdoing. So while you're a nurse, your ethical background, like knowing ethics, is going to be able to help you in your career observing wrongful treatment, or unethical treatment. Knowing this stuff, you have to speak out, especially when it comes to the medical field. You have to speak out. You cannot just let unethical things go on. Um, because basically, ethics provides the groundwork for deciding issues and making judgments. I think that ethical guidelines help nurses in difficult situations, and it provides a moral compass for like the healthcare all across the world. There's also several moral dilemmas that healthcare workers face all the time, and being able to identify these dilemmas and being able to know how to appropriately react to them, the dilemmas, and what would be the right answer to the dilemma, is super helpful. And it also helps to make good judgment calls while still abiding by the laws when it comes to nursing. Um, Ethics helps to understand the right thing to do from the inside, but it also gives a guideline for the right thing to do for the inside and the outside when it comes to the healthcare. Um, I also think that, again, like I said, recognizing the ethical issues, and you always want to do what's right for the patient. And if something unethical is occurring in front of you, it is absolutely your job to report it, because otherwise you wouldn't be doing, beneficence for the patient. They wouldn't. That's not part of nursing. Is, not to just sit there and let an unethical thing happen to a patient of yours. So yeah, that's my definition. So I'm sorry about all the chaos, and I really appreciate you. Thank you.